Next, we're going to look at another alternative modality for the treatment of bursitis, tendonitis, pain. And rather than using phonophoresis with the ultrasound machine, we can also use a modality that is known as iontophoresis, and it uses electrical current to drive a molecule into the skin versus sound waves, which is what phonophoresis uses. And the way that these are set up is each of your patches that you will look at. Now, this is one of the newer style patches. Most of them have a positive and a negative polarity to the patch. What you have to know, and we will go over this in class, is depending on which molecule of medication you're using, you need to know the molarity of the medication, the polarity, excuse me. So we're going to be using dexamethasone today, which as a molecule has a negative polarity. So if we want the medication to be electronically driven transdermally through the skin, if we have magnets, do opposite charges attract or do like charges attract?
Opposite.
Like charges will repel themselves, right? So if this has a negative polarity, where do I want to apply the medication to? The negative side of the patch, because the electrical charge will repel the medication, right? And so we were going to use sterile saline because saline is both positive and negative. It's a neutral, and we're going to use that on the opposite side as a buffer. So also one thing to be aware of is each one of these patches tells you how many milliliters the patch will hold. So if you look at the top, this one says a maximum of 1.5. There are different sized patches. Each patch takes a different amount. You have to make sure you know what that amount is. If you overfill the patch, when you try to apply it, it will ooze out all over the place and it will not stick anymore, and you have wasted a $6 or $7 or an $8 patch. So, so this one is 1.5, so I'm going to look at my sterile saline and just make sure, if you look right there, it says it's right at 3 milliliters. So I'm going to apply half of that to the positive side, just nice and slow. There we go. So now I'm right back at 1.5, so we're good there. And then same thing here. So I know it'll hold 1.5, so I'm going to draw out 1.5 milliliters medication and apply the medication to our negative side, because the polarity of the medication we are using is a negative polarity. You can also use, there are lots of different medications that can be used for this application. This one is an anti-inflammatory. We can also use a lidocaine or a pain one for pain, more specifically than anti-inflammatory. So I usually give this just a second to absorb into the matrix there, the pad. In that time frame, I'm going to take and clean the skin. So I want to clean the skin for a number of reasons. One, I want the patch to stick, to be able to stick pretty well. The other one is I want to remove as much of the oil off of the skin as I can. Because if I'm trying to drive the medication into the tissue, into the skin, oil becomes a barrier that limits that. So we're going to really just clean everything really good. Perfect. Let that dry. Okay. So in this situation then, we are ready to apply the patch. We've already kind of discussed precautions if there's allergic to any medications, any kind of allergies. Gone through those with the patient. It's always good to ask that over and over and over again. So in this case, you start at the tip, this comes loose, you peel this off nice and slow, and then when you apply this, the one thing that you definitely do not want to do is apply pressure to the center of that patch. So we know the negative side we want to apply over our area that we are having most of our discomfort or over our problems. So in this case, I'm going to apply the negative side. And if you watch, I'm going to start to seal the medication into the patch. So we're going to apply all around the borders. but I am not going to push on the center of that patch. Again, if you push on the center of the patch, you squish the medication or the saline out, and then this will not stick, and then you either have to take tape and trying to tape everything down. It just limits the effectiveness of the treatment you're trying to accomplish. Now, depending on the patch that you're using or the brand of the patch you're using, you may be done. So a lot of our brands, you apply the patch, they either wear it for 6, 8, 10, 12, 24 hours based off the manufacturer's recommendation, depending on the patch you're using. In this case with IMPI, and these are the ones we'll have in the clinic, we would then apply our hybresis unit. This is a device and a setup that's specifically for this company. We would go through, start the treatment at this point, turn on the unit. You'll see the light come on. You'll see a green light start to bleep. Once I hit start, it's going to start administering. This usually runs, you may feel a little tingle, maybe even kind of almost like a little sting. So this will run for typically 2 to 3 minutes, and then it all shuts off, and then this comes off. And they will be allowed to leave the clinic at that point in time. If they can tolerate the hybresis mode, and we'll go through the settings when we do this in lab, they typically wear this about 2 hours. If we have to make modifications, if they're too sensitive for that, then we'd have to adjust the time that they wear the patch accordingly.